This is Dr. Chaya Makhija. I'm a board-certified endocrinologist and lifestyle medicine specialist and a proud direct care specialist. What is direct care? Direct care is an alternative healthcare model where there is a signed agreement between the patient and the physician or the physician specialist for the healthcare services being provided by that expert. This excludes the middlemen, which is the healthcare insurances, so that there is no dominance or no say of the shared decision making between the patient and the physician. What is the value? The accessibility to the physician at all times. It could be any mode, in-person visits, telemedicine, secure email, secure text messages, patient portal, or even a phone call at any time. The second one is there is no wait period. You don't have to wait to see the specialist for X number of weeks or months. In my practice, I don't have any referrals that needed to be done. If the patient thinks that they need to be seen by an endocrinologist, they could just call and make an appointment and seek the endocrine expertise. The other part is the unrushed visits. The patient visits for the first appointment or the first consultation could vary between 60 to 120 minutes. That's 1 to 2 hours. Have you ever heard about that? Even the follow-up visits are between 30 to 60 minutes, sometimes even more extended, depending on what the patient's needs are. There is ample amount of time to provide education, lifestyle counseling, as well as discussion about the risk and benefits of medications, injectables, including diabetes education, training on diabetes technology in my field, and beyond that is collaborative care, where we get ample amount of time again as physicians to reach out to the patient's healthcare team to coordinate the care and make it more collaborative. Direct care also allows us as physicians to access wholesale prices for imaging or lab tests. These exact imaging or lab tests could be massively expensive when we use our healthcare insurance versus just using cash pay prices. Also, the medications or the drugs that could be available more reasonably priced with coupons or with appropriate wholesale pharmacies are accessible through direct care. All in all, it is definitely maintaining a true sacred patient and physician relationship. I get to do house calls. There is no endocrinologist who would want to do that in a traditional care setting. Neither is it provided or allowed or reimbursed by the healthcare insurances. Today, I could opt to do so when my patient needs it. You may call it unconventional, but it is actually the old way of practicing medicine, where your physician is actually spending time with you and understanding beyond the disease, getting into the root causes, getting into the mental and psychological aspects of the healthcare. Endocrinology is mostly related to hormones and different organ systems which affect our metabolism, including diabetes. That needs time to connect the dots, to solve the jigsaw puzzle, and to help patients either to alleviate their symptoms or at least to guide them through the complex healthcare system so that they could find the right answers. Now, these services are also provided in traditional care, but there is lack of time, lack of accessibility, and how many times have you encountered rushed visits? I personally practiced in traditional healthcare model for longer than 7 to 8 years, and those were the key factors that felt that there was no sacred relationship between a physician and patient maintained anymore. And that's why I opted for direct care. I started my practice in October of 2021. One of my patients, he was in the ER in one of the larger healthcare systems with type 2 diabetes mellitus for more than a decade on insulin injections without any specific care provided by a primary care physician and never seen an endocrinologist. He used to just get refills from urgent care on and off and took care of his diabetes somehow. This patient called me from the ER while making a search for trying to see an endocrinologist. He mentioned to me that he called 10 different offices and none of them would accept to take him, even though he's got history of diabetes, on insulin with a foot ulcer, because there was a referral needed. The next day, I met with the patient and he was all willing and motivated to do whatever it takes to control his blood sugars so that the foot could have been saved. Today, he's walking, enjoying his job and traveling around. His A1C, that is the hemoglobin A1C, is between 6.2 to 6.5%. He's not on any insulin injections. He is enjoying his weight loss of 40 pounds and come to a very stable weight. He's not on any medications for his blood pressure. How did this happen? I would give kudos to the direct care, where we spent weekly to almost sometimes daily visits initially to train him on what the root causes of diabetes is. We talked about insulin resistance, how to tackle it with food, with movement. As you know, he couldn't walk because of the foot ulcer, as well as the right medications. He's not on any weight loss medications today and has done it by himself with the right one-on-one coaching, which is provided by a direct specialist. To empower this patient with the right medications, with the right tools like a continuous glucose monitor, he's become independent. Imagine how much of healthcare cost reduction there has been by discontinuing 4 insulin injections, which was done safely and needs expert care at most of these times. This is all possible in direct care because time, access, as well as personalization of healthcare is very much needed. So in summary, maintaining the sacred relationship where the physician specialist can truly practice art of medicine with time, expertise, accessibility as the main priority for the patient. And it's so truly personalized that I would never go back.